from the News Channel 5 network. This is Urban Outlook.
Hello and welcome to Urban Outlook, a forum for African American issues. I'm April Eaton. Thank you so much for being with us today. Even as the White House administration is racing to put vaccines in the arms of Americans who want them, there's a growing concern across the country that people who live in underserved communities, those far from a pharmacy or lacking in local health care, could have a harder time accessing the vaccine to fight COVID-19. These places have a name. They're called vaccine deserts, and researchers found Black Americans are far more likely to live in those vaccine deserts. Here to discuss the situation and some possible solutions is Dr. Farmer Dixon. She is the Dean of the School of Dentistry at Meharry Medical College, but she also holds a degree in science and public health. Thank you so much for joining us, Dr. Farmer Dixon. We appreciate you being here.
Thank you so much for having me here. It's an honor for me to have the opportunity to be here and have conversation with you regarding the vaccine and access to it.
Well, Mahari has certainly been in the news, all of the work that you all have been doing, not only with the testing of vaccines early on, but also making sure that people got tested to make sure that they were safe and healthy. Talk a little bit about the work that Mahari has been undertaking when it comes to COVID-19.
Mahari has always found itself deeply embedded in the community. We think that that is important for us to do that. So while this is an unfortunate time with the vaccine, we thought, and with the virus, we thought that it was important for us to continue to do what we've done since our inception, and that is providing services to our community, and more importantly, providing services to underserved communities. So when the opportunity came as it related to the virus, we saw it as an opportunity to continue to do, as I said, what we have done. And our philosophy is to meet the people where they are. We've been in this community since our beginning, and we've been providing services. So this was routine, if you will, for us. But more importantly, what we also realize and recognize is that because we are here, not everyone can come to us. And so it's important for us to have the philosophy of let's meet the people where they are. And how could we do that? And we know that there's power in numbers. And so we were able to partner with area churches that were deeply embedded in communities throughout Nashville. And through those partnerships, we were able to take COVID testing to the communities to create greater access and availability of testing for people who not necessarily could make it to one of the stationary sites during the week, and because they're working or because of transportation challenges. But by having these testing events on Saturdays, that created greater availability and accessibilities for the communities. And as we've transitioned and the vaccine is becoming more available, we saw that this was yet another opportunity and a calling for us to continue to do the work that needed to be done, and making certain that we were doing our part to provide the vaccine to our community, and especially to people of color. And so we have been doing that, and we're ready to be available and to work out the logistics. And of course, you know, it was a team effort of having, I describe it as this was the ideal demonstration of interdisciplinary and interprofessional collaboration coming together from dentistry, medicine, social work, all of these various disciplines, law and legal, compliance, coming together to look at how are we going to provide these services and make certain that, one, we're keeping people safe, that we not only want to provide the services, but we want to make certain that we're educating and informing the community because there's so many misconceptions, and we wanted to give factual and accurate information as well. So by a lot of meetings and a lot of coordinating, we were able to provide the testing and, of course, now the vaccine.
It's interesting you talk about needing to meet the people where they are. That's what conversation that's going on now about these vaccine deserts, similar to food deserts where you have a lack of grocery stores and healthy food options in communities. There are so-called vaccine deserts. In fact, your president and CEO of Meharry, Dr. James Hildreth, is quoted as saying, even though 90% of Americans live within 3 miles of chain pharmacies, there are many others who live in these so-called health and food deserts without a pharmacy close in range. And we saw a number of different other things that have come out, especially from the University of Pittsburgh School of Pharmacy, that said there are about 1.6 million people who must travel more than 20 miles to the nearest pharmacy. The connection there to the pharmacy, of course, that's a location where they could possibly get the vaccine if they wanted it. How serious is the problem, Dr. Farmer Dixon, of these vaccine deserts out there where underserved communities, rural communities, people who live in these communities are unable to get to the vaccine?
Sure. Nationally, and you just mentioned nationally, they're saying that there are vaccine deserts. I think ABC reported that approximately 150 counties throughout the United States are vaccine deserts, and Tennessee has vaccine deserts as well. While you'll hear reports that will say the majority of the test of the vaccine distribution has happened in Memphis, Knoxville, and Nashville, there are also those counties where there is a limited availability of the vaccine. Tennessee probably has about 8 counties that they're reporting as vaccine deserts, and these are in rural areas like Bedford County or Stewart County, Benton County, where it creates challenges to get the vaccine there. And I think in those particular instances, especially not only in those counties, but even in, I'll say, in Nashville and in some of the inner city areas, making certain that the vaccine that's available, it is going to be meeting those people where they are. And when you recognize that there is a vaccine desert, it's one thing to recognize that it's there, but what are you going to do? And I think one of the strategies is partnering with community organizations, with church organizations. This is going to be a thing where it has to be a team effort and a team approach to meeting the people where they are and getting greater access and greater availability of the vaccine in those rural areas, in those remote areas, having what we call mobilization teams that will be able to go in and provide the vaccine in those communities.
Dr. Farmer Dixon, is there still a fear of getting the vaccine? We look at the history of Black people and some of the things that have happened in the past. The Tuskegee experiment comes to mind, right? Where people were unknowingly and unfairly used as guinea pigs. And then you talk about the situation that we're dealing with now, the COVID-19 pandemic, and whether there are any fears that exist with a vaccine that some say was rushed to get it here for the right reasons, right? Because we've got to have a way to combat what we're going through. But is that fear, that trust factor of medicine and how it works, still present in our society, in our community, our Black community?
That fear, it does still exist, and it's real, and we have to accept that and acknowledge that. And I think that history has attributed to that, as you alluded to. But I think that gives us an opportunity, us as Mahari, to continue what we've been doing, is talking in the community, being engaged in the community to make certain that they're informed. But we're not the only ones who are doing that. Other organizations, there's, what do we say? Knowledge is power. And so making certain that people are informed in our communities so that if they are informed with accurate information, they can make informed decisions. But I want to say also it's twofold. You do have that there are some people who are hesitant because of history, because of a distrust in the sciences, a distrust in the government and in policies. But there are also those that are in the community. There are African Americans that want to get the vaccine, but are having challenges being able to get the vaccine. So I don't want us to think that the low numbers that we're seeing in the percentage of African Americans is solely because of a hesitancy. That is not the only reason, but it goes back to where they are located, the availability of the vaccine, having access to the vaccine. So if I was going to describe it, I would say that the challenges are availability, accessibility, and acceptability.
That's an interesting point, and I'm glad you did sort of make sure that you put that to the forefront. So it isn't the fact that we're afraid to take the shot, but the lack of availability of the shot is a key point there. Let's take a quick break, Dr. Farmer Dixon. When we come back, I want to talk more about what Mahari is doing to make sure you get the word out and the shots out to people who want them. We'll be right back after this.